Hi, a very good afternoon. A very good evening. For that matter, it's 7:30 p.m. So we're starting our second live session today. So it's great to be back again. So thank you so much for your overwhelming response in the first session. So even in this session, we'll be discussing more of general topics, right? If you have any questions, you can pose any general question pertaining to tips for MDS entrance or a NEET MDS orientation, right? So I'm eagerly waiting for your comments. So in the process, I'll be discussing a few things which I wanted to share with you all today. Right. Let me just check out whether it is live streaming or not. Yeah. Yeah. Right. Yeah. Right. So in the previous session, you posed several questions pertaining to like how to prepare for entrance, what books to refer, and most of you mailed me also. So I hope you have seen the list which I have sent you. So in this session, we'll start with the first topic, that is the guidance. So as I mentioned in one of the previous videos, I mean way back when I posted in last year Jan 2016, where I mentioned clearly few points pertaining to NEET MDS orientation, right? So the first thing which I would like to discuss today is guidance program. See, we often have this doubt, right? So when we are preparing for any entrance or for that matter anything, we have this ambiguity, like whether we have to join any coaching or whether can we go for a self preparation, right? So we always have that doubt. So to answer that question straight, so whether you want to go for a live, in the sense you want to go for any guidance program or you want to prepare for yourself, it all depends on your own choice. But see, joining a guidance program doesn't guarantee you a rank or a seat. So ultimately it's all about how well you do when you are preparing in your respective entrance, right? So it's not that since I have started one guidance coaching program, it doesn't mean that I have to endorse that. To be frank, even when I was preparing, I joined in one coaching institute in my area in Andhra. So like it all depends. See, for me personally, I need some kind of a motivation, because extrinsic motivation is often necessary for me so that I could push myself within my limitations. So I needed a guidance program, so I joined in one coaching institute, and based on that I prepared accordingly, and I was pretty much satisfied. But there are instances where even most of my friends, like they had their own self preparation. See, if you can plan well, if you can plan your preparation properly, and if you have that strong willpower to follow what you have planned, see, in that case you can really go for your self preparation, right? So whatever it is, you need to spend maximum time in a given day, and definitely guidance is going to help you, but it's not that guidance is the only means to secure a rank or seat, right? So in my opinion, around 5 to 10% contribution goes to guidance program. The rest 85 to 90% depends on our efforts, like how well we prepare, how well we plan, and how well we execute, and how well we stay focused till the date of exam. Because we often see most of us will stay focused when we are starting preparation. For example, if you are starting now, then we'll be very much happy, we'll be very much excited, showing a lot of enthusiasm, and we'll be preparing very well. But in the process, we'll be losing that enthusiasm, right? And again, before exam, we have this panicky feelings, right? So we need to control ourselves. If we can control our respective attitudes, and if we can just hold on no matter what the scenario, what the situation is, then definitely we're going to achieve success. So it's not that only coaching program or coaching or online guidance or offline guidance is really going to take care of everything. It all depends on our innate motivation, our intrinsic motivation, and the factors which really influence us in our given atmosphere, including friends, family, and also the way in which our guides really motivate us. So all these factors depend, but most of the contribution is by your way of implementing things in your day-to-day lives, right? For example, if you prepare a schedule, how well you're following it, and how well you're able to understand the subject, and how well you're able to process it and then apply it, and how well you're able to solve multiple choice questions or refer standard textbooks, right? So there are certain guidelines which we need to follow in order to achieve a success, in order to achieve our target, right? So regarding guidance program, it depends on your interest. If you feel like you can self motivate, if you feel like you can take care of your own schedule, then you need not join any guidance program. However, if you feel like, yes, I need some kind of motivation, I need some kind of guidance so that it will be easier for me to crack entrance, then definitely you can plan to join any guidance program, right? And then, as I mentioned about the standard textbook references, I just wanted to highlight this particular topic here, because most of us often, even in the previous live session, I got several questions pertaining to this standard textbook references. Aspirants do ask whether we need to really go for referring a standard textbooks, but as a fact of matter, even though it's time taking, there is no real alternative for a standard textbook reference. If there is any time constraint, then based on that we need to modify our preparation, but we can't substitute for standard textbook references, right? See, if you have adequate time, if you have 1 year time, if you're preparing, if you're starting your preparation, if you're giving your entrance in next year, then definitely you need to have your standard textbook references as well. And coming to a mode of preparation, coming to a way in which you orient yourself for the entrance, just keep this in mind. When you start, for example, you're starting with one particular chapter, right? For example, in anatomy, a particular chapter, we have to go through synopsis. That's what we all keep on doing, right? And rather than starting with textbooks, we need to go through synopsis and then solve multiple choice questions simultaneously. And when we solve multiple choice questions, right, see, you can solve them in groups or you can solve entire chapter at a time. It all depends on your personal way of approach, right? So once you solve, so make a habit of noting down the question numbers first. That's what I used to do even personally. So you just take a white paper, just take a booklet or a piece of paper and then note down all the questions. For example, if you're planning to solve first 10 questions in a particular chapter, then what you do is you just note down the question numbers, and then without referring answer or key for every question, you can just solve questions in a groups, like 10 questions at a time or 20 questions at a time, depending upon your level of motivation or interest. So once you're answering those questions, you note down the key or the options in the book which you are maintaining, right? So at the end of that, once you complete a set of 10 questions, for example, you cross refer, you cross check, and then see where you have gone right and gone wrong. And those multiple choice questions, right, where you have gone wrong, you need to definitely, whether you're right or wrong, you need to go through the explanatory answers. And especially those multiple choice questions where you have gone wrong, you need to refer standard textbooks if at all, if there is any ambiguity, because once you have gone wrong, it means that you have a concept wrong, or maybe it's because of a memory related issue, right? So in those circumstances, you need to maintain notes, not this a smaller one, but you need to have a separate notes. You need to you can just divide that notes, take a huge notes, 200 pages or 300 pages, divide it into various sections, and in that notes, based on subject wise, topic wise, you can note down all the relevant important memory based point or topics where you have ambiguity or concepts which you don't have any clarity or formula, and all these things have to be entered in a single notes, right? So this way in which this way of entering things in your notes really helps you to revise them at a crucial point on a later date, just before the exam, right? Because you will not know the value of that notes now. We'll assume that it's a waste of time, but frankly speaking, it's an investment in time. In the sense, it's a very good investment, because once you have this high yield synopsis, once you have this custom made high yield material which you have compiled, it's not that you need to write down anything. As I mentioned, depends, right? So this will really help you enhance your confidence, enhance your motivation, which is more important than the knowledge which you have gained during the process of preparation. No matter how much knowledge you have gained, no matter how much confident you are, no, see, it's all about confidence at the end of the day. On the particular exam day, no matter how much knowledge, as I mentioned, if you don't have that confidence, if you don't have that right orientation and attitude, then there is high chance that we will lose out in the process, right? So we need to find newer innovative means through which we can really increase or the intensity of our motivation, right? So all these factors do play a major role, right? It's not that we need to only secure a knowledge and information and try to place it on paper. No, it's all ultimately about a confidence. The more confident you are, the better will be your performance. It's not that I'm trying to undermine the information or knowledge which we gather in the process. It's about these factors which play a crucial role, which we often tend to neglect, right? So these things we need to keep in mind, right? So in that process, we solve multiple choice questions, refer standard textbooks where and all necessary, and then based on that, right, we'll maintain notes, right? So this is a process, this is one of many process which you can follow in order to boost or enhance your preparation, right? So multiple choice questions, before that synopsis for a brief understanding, for a brief idea, and then followed by multiple choice questions, then followed by referring your answers, understanding yourself, understanding where you are having clarity or where you're not having clarity, that's even more important, and then referring the explanatory answers, the standard textbook references, then maintaining notes, right? So if you can maintain this cycle more or less, then obviously the confidence which you get would be much more great. You will not know that now, but just before exam, 1 week before exam, 1 month before exam, you have this, as I mentioned, a customized high yield synopsis that adds to your confidence. It's not that you're going to get multiple choice questions only from the notes which you have compiled. It's all about gaining confidence at the end of the day, right? Hope I'm clear, right? So we have we have our first comment, Abbas. Hi Abbas. Sir, is there any image-based good book for NEET? Abbas, I already mentioned in the previous video regarding this. See, we have been providing image-based questions in our demo test as well as in our test series, and so far we have compiled around 50 to, I think it's around 75 multiple choice questions, image-based questions, right? And we have been compiling more and more, and we'll be getting more and more questions in our test series. And apart from that, you can find a number of image-based questions. Even I personally referred one target MDS book, an image-based book, and I felt like there are many images, topic-wise, right? So you can go for that. You can even search in Amazon. You will get more information over there, right? So you can try for that. See, image-based book, it's not that you have this compiled book which you need to refer. It also depends on, see, when you're, as I mentioned, when you're free, in your free time, you can just open up endo textbook, any standard process textbook, right? Or just refer previous year papers. You have these image based questions mostly from diagnostic part, right? So oral medicine and radiology, radiographic features, the oral findings, oral mucosal findings, heart tissue findings and all. And also we have even questions from like identify this device, identify that hand instrument, right? So based on that, once you have this understanding, then you start referring a standard textbook, Abbas. You start referring, for example, for instruments, you can refer oral surgery standard textbook, you can refer endo, Grossman, and you can also refer this conservative textbook, right? So for oral medicine, Burkitt's, for oral radiology, White and Farrow, right? So it's not that a particular image-based book will really boost our understanding of these particular set of questions. We need to prepare, compile our own things. In the sense, you just have make a habit of referring various images that have been provided in your standard textbooks, right? That's for your understanding, not that you're going to get the same thing in your exam, but that's for your better understanding, right? Hope I answered your query. Next, right? So along with this, so I would like to discuss the role of friends in this particular live session, because see, friends, they play a very crucial role. See, I had, as I keep on saying, our batch, I was lucky to have some good friends along with me, some good friends who are serious in their preparation, cooperative, trying to understand each other. See, even when we were writing different exams, it can be either COMET or we had NEET way back in 2013. And also we applied for various other exams, and we used to go together, we used to have fun, we used to have a positive atmosphere, to be frank enough. So that really used to keep our momentum going, even though like we felt a bit depressed if we hadn't performed well in the exam. Our friends really play a crucial role in boosting our morale and confidence. That's why I said having good friends, having quality, these good kind of friends is really important, right? So, and coming to their particular role in preparation, see, when you're preparing simultaneously along with many group of friends, it's like we have these group studies, right? So often we have this issue of deviating when we are studying in groups. We all have that problem, right? So in order to overcome that, it's not that you need to constantly do group studies. We can have different approaches. For example, if you're studying, if you think that you can do your level best when you're studying alone, then stick on to it. And at the same time, it doesn't mean that you should keep away from your friends or you should not discuss with your friends. It's a discussion, I feel, with your friends especially is the most important aspect in the process of preparation, because once you understand subject, you'll be able to explain them properly. Once you are able to explain them, it means you're like sharing your information with your friend. Not that he'll get more marks compared to you, but it means that you have understood what you have been explaining, right? So for you to explain, see, explaining things is not that easy as we assume. In order to explain things, we need to understand first, right? So in the process of discussion, we will be registering the information more into our brain. And also remember, rather than merely studying on a book and then remembering, once you discuss with your friends, even after a few months, even after a year, you'll remember the incident. You will remember the circumstance where you know that you have discussed that particular point with your friend, right? So this even enhances your memory, right? So it's like a strategy, like you can discuss with your friends, and also in the process you'll be studying, for example, out of 10 topics, if you had gone through 8 or 9 topics, it's not possible for us to cover all the topics, right? So there is a chance that you'll be learning new things from your friends as well. So this is a kind of reciprocation, right? You studying and explaining to your friends and vice versa. It has to be a kind of reciprocation, not a one-way traffic, right? So in that process, definitely there will be enhancement, I mean, in the process of preparation, and friends do play a very crucial role. And combined studies, coming to combined studies, yes, combined studies, as I mentioned, they in process of discussion you can definitely do it. But if you feel like you're compatible with your friend, like, see, just keep this in mind, combined preparation should be synergistic, rather than reducing the amount of time you spend on your respective preparation. It should be synergistic, and it should be able to boost or enhance your respective preparations rather than trying to suppress them, right? So if you have that kind of positive reciprocation, then definitely you can go for combined studies as well, right? So we have more comments coming in. Jagadish, hi Jagadish, good evening. Normally they say that dentist is good for basics, so do we need to shift to from pulse to dentist for basics? Jagdish, it's not about, see, as far as I believe, each book has its own pros and cons. As you said, pulse will be following the basic pulse, most of us, right? So even dentist, I heard of this thing what you said, but I'm not exactly sure, because as far as I believe, I had gone through Pulse, previous AAPG papers, Neeraj, Vadhavan, and dentist. I have followed few questions here and there, because I found few explanations very good, right? So it's not that you need to follow dentist only for basics, nothing like that. I don't think so. Pulse would be suffice. Of course, dentist, if you're following dentist right from the beginning, then obviously even you can continue with that. It's not that one book is superior compared to other book. Each book has, as I mentioned, has its own pros and cons. So you can definitely follow one or two books in the process of preparation, and that gives you more amount of exposure, right? And also, if you feel like you have more basic questions from dentist, then obviously you can go for dentist, right? Abbas, yeah, thank you, sir. One more thing, is there any particular syllabus for NEET? See, Abbas, I have gone through this NBE website, National Board for Examinations, who conduct our NEET PG or NEET MDS, right? So in their website, it's clearly mentioned that the syllabus for NEET will be in compliance with BDS Regulations 2007. BDS course syllabus regulations 2007, and you can find the course syllabus in DCI website. If in case you want me to mail you, I can mail you. That would be my pleasure. You can mail me at proudtobedentist@gmail.com. I'll mail you the entire syllabus. The entire syllabus has been given in DCI, right? So that particular syllabus which the DCI prescribes as per newer regulations 2007, that's the name of the PDF file which they are uploaded in DCI website. You can check into the website, you can download that, and you can refer. So that is a syllabus which is being followed in our NEET entrance perspective also. There is as such nothing a separate syllabus for NEET. See, let me tell you frankly, the name of exam has changed and pattern has changed a bit comparatively, number of questions and time. However, the essence of the exam remains the same. It's the same exam as AAPG, APPG, or any other entrance. It's the same nature, but the name has changed, the duration has changed, and the number of questions has changed. But the syllabus remains the same. It's the same basic syllabus prescribed by our DCI, right? You can mail me. I'll send you the PDF if you wish to. Right, Abbas? Yeah, Neil Nandan. Good evening, Neil. Very good evening. Sir, please tell how to prepare for community and preventive and social medicine, PSM, right? See, Neil Nandan, which book are you following for community? I mean, you shouldn't call it community. If I say community, my professor will scold me now. I mean, when I was studying, I had one lovely professor, Dr. Suresh, and he used to say, it's not community, it's public health dentistry, right? So, which book are you following, Neil Nandan, for public health dentistry? See, when we, let me answer first. You can just comment which book you're following. In the meantime, I'll answer that. See, when we were preparing, we referred Park for social and preventive medicine, right? Park textbook, 28th edition, I guess so. And also we referred another book. What is it? For community. I'm not getting the name. It's a common book which we all refer. I'm not getting the name. We used to refer that book, and most importantly, we used to follow synopsis blindly, especially when preparing for entrance. So we used to follow synopsis, all those qualitative tests, quantitative tests, tests of significance, different units of measurement. So we used to give, frankly, yeah, it's Soban Peter. Jala, thank you so much. It's Soban Peter, right? So textbook reading, we used to follow Soban Peter in Park. We used to understand some subject, but we took it seriously when we were going through synopsis, right? So when we were in undergraduation, we didn't give due importance to, frankly, social and preventive medicine or public health dentistry. But once we entered into internship, once we started preparing, we followed synopsis blindly, which is not a good way to start with. You need to follow a textbook. But what we have done is, as you asked me directly, like how to prepare, go through synopsis first. Neil, go through synopsis, try to understand and memorize simultaneously. You need to memorize various units, various quantities and all, right? Yeah, Neil, it's Soban Peter. So you need to memorize all these things, and along with that, there are certain concepts which you need to understand, right? For example, you have these different cross-sectional studies, longitudinal studies, cohort studies, right? So it's like understanding them is very important, and then memorizing them simultaneously. And also take tests for significance. You need to understand the concept there, and then you have to memorize them simultaneously, right? So that's how you can approach first. Go through synopsis, then start practicing multiple choice questions, and you'll definitely go wrong in certain concepts, especially, I'm not trying to discourage you, but tests of significance and certain other aspects in community, public health dentistry are comparatively challenging. In that case, you refer Park, you refer Soban Peter. You have these references, make a note of them. As I mentioned in the beginning part of this video, you can then continue preparing, right? If you're preparing for entrance now, if you're preparing for entrance this year, don't start with textbook now. Start with synopsis, multiple choice quiz. The same basic principle applies to everything as far as my experience is concerned. If you feel like you can do much more better with your with a new idea, with your own way, then you can obviously go for it, right? But if you think that like the best way available, given the time constraints, you have another 5 months, right? Go through synopsis. Go through synopsis of different books like Pulse, dentist, if at all. Dentist will be having more or explanatory answers, right? So go through various multiple choice questions, get exposed to as many multiple choice questions as possible, and try to gain confidence, right? That's very important. Jagadish, thank you, sir. Yes, Jagadish, hope I answered your query, right? So it's not that you need to follow only one book, right? If you ask me directly which book you need to follow, go for 2 or 3 multiple choice question books, right? You have time, you have plenty of time. You follow one book first. If you have started with Pulse, complete Pulse. Then you go with dentist. Then you can go with previous AAPJ papers. Then you can go with previous NBD papers, right? Get exposed to as many multiple choice questions as possible. And that's my straightforward answer to you for your particular question, Jagadish. Right. Abbas, yeah, you're welcome, Abbas. Yes, okay. Dr. Kumari, hi Kumari. You have asked me, I think you have seen my mail yesterday, right? Yeah. Is synopsis enough? Not exactly, Kumari. Synopsis is like, it's your beginning point. Synopsis is the starting point, to be frank. It helps you to start. Just imagine you're starting with anatomy today. You want to start with anatomy subject today. Just imagine if you start with the textbook. You have just 5 months time, 6 months time. See, I'm talking this keeping in mind the entrance exam in this year, right? If you are in first year or second year periods, then obviously you have to start with textbooks. But once you have entrance in this short period of time, it's practically not feasible to really start with your textbook now. It will demotivate you in the process. So the best way is synopsis. So Kumari, synopsis is necessary but not sufficient, right? It is necessary but not sufficient. You need to go through synopsis for your understanding, for a greater overview of the subject, right? And then MCQs, and then so MCQs will test your knowledge, and then through explanatory answers and through standard references, standard textbook references, you will be imbibing more and more information in the process, right? So that's how you can proceed, right? So synopsis is necessary but not sufficient. Hope I answered your query, Kumari. Right. Farzana. Hi, Farzana. Sir, what about picture type questions? Farzana, I've been discussing that previously also. You can go through some picture based MCQ books available in market. You can go through Amazon, you'll just find some books there. And also the best way is analyzing previous entrance papers. Farzana, just analyze previous entrance papers, right? So you have more or less picture based questions from the diagnostic part. They'll be giving you some oral finding, mucosal change or heart tissue changes, and they'll be giving you a brief history pertaining to that question or pertaining to that picture, and they'll be asking you the diagnosis or treatment part or the etiological factors, right? So that's one aspect. So you have picture based questions from oral medicine, right? So the findings of oral cavity, and also you have picture based questions from the radiographic findings, OPG findings, IOPA findings, and normal anatomic features and all, right? And also you have picture based questions from various instruments, identification of various instruments. From it can be either oral surgery or elevators and all. You can even have questions, you can even have these micromotors, you can even have these autoclaves. Various machines can be asked, can be posed as picture based questions and whatnot. Even endodontic files, endodontic instruments, and endomotors, right? So the best way is, when you're referring, see, obviously when during our process of preparation, see, it's like taking it as an advantage, right? Whenever you come, you feel like picture based is an additional burden. No, it's not. Take it as an advantage in the sense, when you're preparing, for example, if you prepare 20 minutes at a stretch or 1 hour at a stretch, then you take a break, open your standard textbook, just skim through the pages. You'll come across various picture based questions. And see, often when you're preparing during undergraduation, we never go through the legends, the matter given beneath the pictures, right? So now you can just go through the legends as it's like you can do it freely without any stress. You're just going through, you just skim through passively, trying to understand what it is, what kind of picture is it, right? So that's how you can build up confidence, right? So no matter what, it's not that you'll get the exact picture from there in your entrance directly, right? It's for gaining confidence, right? And also you have various picture based MCQ books. And Farzana, we also have picture based questions. We have composed around 75 picture based questions so far in our test series as well. We are even providing them in demo tests and also in our regular weekly tests and revision tests. You can subscribe for more picture based questions as well, right? I hope I answered your query. Shahnaz. Hi Shahnaz. Could you please give an order in which it is better to cover subjects? Shahnaz, it's like a customized one. It should be an individual choice rather than going by a preformed schedule, right? So see, more or less, if you want me to answer that straight, you can go with basics first. You can go with basics first and clinicals last. The reason is, even when we were preparing, we gave due importance to basics first, because basics you might have gone through them in way back 4 years ago or 5 years ago if you're in internship now. So you'll be lost in touch with them. So start with basics. Anyways, clinicals, we are all more or less thorough because we have that clinical exposure. So we'll be comparatively confident in clinicals, right? So start with basics. And then once you complete basics, you can jump on to clinicals, or you can formulate another strategy, Shahnaz. You can even go for a combination of one basic subject and one clinical subject. Like for example, anatomy and oral surgery, right? So you can go for these combinations, right? Endo and cons and endo, you can go simultaneously, that's fine. And you can go for oral path, general path, right? You can go for these combinations, and if you want us to assist, we'll definitely assist you in this. You can mail us, we can send you our schedule. I hope I have already sent you one schedule, right, in one of the previous communications. I'll send you another schedule, or if you feel like you need to go for one basic and one clinical subject simultaneously, you can even plan out in that fashion, right? So that keeps you entertained, right? That's how you can keep on going, right? I hope you answered your query, Shanash, right? Sanchita, hi Sanchita, sir, please tell authentic books for NEET. Hi Sanchita, see, authentic books in the sense you mean to say the PG orientation books or the standard textbooks, or both? Please be more specific so that I can talk in a more specific manner, Sanchita. Farzana, thank you. You're welcome, Farzana. Sanchita, because many mistakes used to be there in MCQ books. That's true, Sanchita. Sir, PG orientation. Okay. So, Sanchita, for PG orientation, exclusively for PG preparation, see, I can't really give you a standard textbook, right? If you can ask me a textbook in the sense or curriculum related, then I can give you some standard textbook references, because I had followed few and I had gone through DCI website, the course curriculum, even they have prescribed some standard textbooks pertaining to our university syllabus. But coming to this entrance point of view, uh, I'm not like I'm trying to promote one particular book. It's like, let's see, all books more or less have their own pros and cons. So it's not that one book is perfect, to be frank. So the best thing is, for example, in one of the previous sessions, one aspirant asked me like, sir, in one book we have one answer for one question, in another book we have different answer for the same question. Then what do you do? In such circumstances, I mentioned previously the same. You need to refer standard textbooks, right? So you have various books, Sanchita. You have to go through more or less 2 or 3 books. As I mentioned, I also mailed most of my aspirants. So I'm telling you now, you can follow Pulse. You can follow. It's not that I'm endorsing books, right? So it's not like I'm biased. I know that each and every author have worked extremely hard. So as far as my knowledge is concerned, you can you follow these set of books. You can start with Pulse, the basic, understand the basics and clinicals, synopsis and all. And once you have completed this, then you can go for previous APG papers. Or if you feel like you have already started with dentist, then you can definitely go for dentist. Complete that. Once you complete one book, right? Don't land in 2 books simultaneously, right? You'll be in soup. Complete of one book, then you just go ahead with previous AAPG papers by Dr. Neeraj Vadhavan, and then you have previous AIMS papers by Atul Soin, and previous NBD papers, right, by Mosby's publication. Also First Aid, I couldn't get this name previously. We have one publication named First Aid, previous NBD papers, Mosby's previous NBD papers. And Sanchita, you want me to send the list, you can just mail me at proudtobedentist.com. proudtobedentist@gmail.com. I'll send you the list of PG orientation books along with standard textbook references, right? So authentic books, in the sense, I feel each book has its own pros and cons. It's up to us for analyze and to understand which book to follow, right? You'll understand that in the process of preparation, right? Hope I answered your query, Sanchita. Farjana, yeah, we have another question. Do we have to give preference to particular subjects? In the sense, I didn't get you, Farzana. Preference to particular subject means, you mean to say the weightage? If you're talking about weightage, then all the subjects have equal weightage, as I mentioned previously. You can refer NBE website also. So you need to give stress, obviously, in all subjects. Maybe I didn't get you right. You can just elaborate your question, Farzana. Right. Next, we have a question from Muhammad Milfi. Hi, Muhammad. Hello, doctor. I just finished my 4th year. D2, okay, second sem. Which is the best way to review all subjects that I took? Ortho, endo, path, surgery to the end. I have solved entire equation of black liberation 35-minute video. Click on which I think I'm getting some ad also. Let me just remove that. Okay, right. So Muhammad, to answer a query, to briefly, you mean to say the best way to review all subjects that I took? Okay. Best way to review all subjects is go through these, these collection of books, right? You can just mail me, I'll send you the list. You have these PG orientation books where you will get a synopsis, a customized synopsis. And also you can mail, Muhammad, you can mail us. We started producing, or we started compiling various key points in each subject, and we have been doing it, and we have been distributing these key points to all our aspirants, all our registered aspirants. We'll do it for you also. You can just mail us, we'll send you the key points list. As such, we'll be covering key points in various subjects weekly. We'll be doing one subject per week, and we'll be sending you via mail. So Mohammed, you can just mail us, we'll give you some key points, and along with that you refer various PG orientation books. You'll have a synopsis, high yield synopsis, and that really helps you to revise most of the subjects quick in a brief manner, right? Hope I answered your query, Mohammed. Sanchita, thank you so much, sir. Oh, you're welcome, Sanchita. Yeah, Abbas. In which subject we need to give more concentration? Any subject-wise mark distribution is there on Abbas? There is a subject-wise distribution. Each and see previously in APG, in APPG or any entrance, we have this skewed distribution. A few questions from basics, more questions from clinicals, more questions from dental materials, more questions from ortho, endo, like that. But now, as far as new syllabus is concerned, new rules are concerned, we have equal number of weightage, equal questions from all subjects, around 12 to 13. You can refer NBE website for more information, right? Even though session wise we have this disparity in number of questions in each subject, more or less as far as our Ministry of Education, Health Education or NBE says, we have equal weightage in all subjects. So we need to focus on all basics as well as clinicals, right? Hope I am clear. So there is no shortcut or there is nothing like important subject and unimportant subject. We need to focus on all subjects equally. Yeah, next Farzana. Hi Farzana. Yes, my question is what Abbas Ali has asked. Okay, you mean to say particular subject, right? So I answered a query also simultaneously, right, Farzana? So you need to focus on all subjects, right? You have equal weightage for all subjects, right? Yeah. Sanchita, hi, yeah, Sanchita, sir, please make video related to fixed orthodontic appliance. Your videos are very informative. Glad to hear that, Sanchita. Yeah, definitely. See, ortho, we have that ortho curriculum in the coming month, so we'll be making more and more videos pertaining to orthodontics also. So you're asking about fixed ortho appliance, definitely we'll also post some picture based questions. We'll discuss many picture based questions clinically in clinical subjects, and we'll definitely do more videos, right? Sanchita, definitely we'll consider your request. Jagadish, yeah, many of our seniors left few tough subjects like pharma, biochem, allotted that time for other remaining subjects. Sir, is that good to follow for NEET? Jagadish, that's what you said is absolutely true. I'm not supporting to what your seniors say, but what even my seniors have done and what most of us commonly do is we neglect basic subjects like pharma. We totally neglect public health dentistry. We completely neglect anatomy because Jagdish, see previously in Andhra Pradesh we had Andhra and Telangana we had this APPG where we have a number of questions, 90 questions, right? I guess 90 for 1.5 hour. And most of the questions are from clinicals, and most of the questions in clinicals are also from certain subjects. And also we used to have around 20 to 25 questions, if I'm not wrong, from dental materials, right? So we had this heavily skewed distribution, Jagadish, previously, but now it's not that way. But now we can't have that luxury of spending more time on few subjects and totally neglecting other subjects, right? Now the scenario has changed. AAPG, NEET orientation, we need to have this broader perspective. We need to focus on all subjects equally. There is nothing like you need to focus on few. You need to, even I got one mail previously, Jagadish. They're asking me like I'll leave general medicine. No, it's nothing like that. Who knows? You can have many questions from general medicine also. The weightage clearly shows, the website clearly shows that we have equal weightage. Now you can ask me, sir, in previous year NEET there was a skewed distribution, right? More questions from few topics, more or less questions from few other subjects, right? So it depended, I mean there was that skewed distribution session wise, right? But we don't know what really happens. We just can't go based on one session, right, or 1 year exam. We need to go by what the rules are being quoted in a standard website. Like for example, we can follow NB website blindly, right? So give due importance to all subjects. And Jagadish, it's not like you can't leave pharma. Personally, I feel it's very important, right? On the analgesics, antibiotics, various classifications, various drugs for hypertensives, right? Systemic manifestations and drugs for those manifestations, they are really very important as a dental student, right? So definitely there is no point in leaving out those basic subjects. And Jagdish, I would like to conclude to your question by saying that, as I mentioned previously, I had one guide, Dr. Sharath, oral medicine professor. The first thing he told me when I joined his coaching was, he said, everyone goes through clinicals. Everyone will answer or master clinicals, but a person will have an upper hand. An aspirant will have an upper hand only when he is confident and when he is thorough in basics. Because even though we used to have, in APBG, we used to have very less questions in basics, right? Even one question from anatomy, we used to have 1 or 2 questions from anatomy. So an aspirant who answers that one question will definitely have an edge over others, right? Because obviously everyone will answer all the questions, all dental material questions, all endo questions, all clinical questions. But an aspirant who is proficient in basics will definitely have an upper hand, and just keep that in mind. And now the rules have changed completely. In NEET, equal weightage, so you need to focus on all subjects. You can't really ignore rest of the subjects, because you can't predict future. Who knows what kind of questions you'll get from the exam in the exam, right? We really can't predict all those things. We need to be prepared 100% from our side, without any errors or without any deficiencies, right? Jagdish, hope I answered your query. Sanchita, yeah, definitely we'll make more videos. Okay, right. Muhammad, yeah, you're welcome, Muhammad. Okay, Kumari, what are you saying, Kumari? To get key points, what you told now, I have to register. Kumari, actually we are providing key points to our registered students as of now. But definitely I feel like I need to give my work to more and more students, so that will definitely benefit all of you. So you can mail me. So all of you listening to all of you watching my live video, you can mail me at proudtobedentist@gmail.com. We'll definitely give all the key point and notes which we have compiled so far. We'll just mail you. And we haven't covered all subjects yet. We have covered around 8 to 10 subjects as far as my knowledge is concerned. We'll be covering rest of the subjects in due course of time, right? So you just send a mail, we'll give you those key points accordingly, right? Yeah. So Kumari, you need not register in order to get key points. You can get them for free. Abbas, thank you, sir. You're welcome, Abbas. Neil, yes, Neil. Sir, which edition of book should be our reference book? South Asia edition or international edition? Neil Nandan, it doesn't make much difference as far as my knowledge is concerned. What kind of edition it is, whether it can be Pacific edition, Southeast Asia edition, or whatever edition it is, what I found is it will be more or less the same standard reference, the same standard information, right? So you can refer any book, any standard book, that's fine. Edition, I don't think that's really a driving factor there. Jagadish, thank you. So you're welcome, Jagadish. Abbas, sir, please make some video related to anatomy. Abbas, we already made very few videos in anatomy, and I posted a very fraction of videos in our YouTube channel, and we have few more videos in our course as well. So definitely in future, in the coming months, I'll be making more and more videos, right? So far we have made around 175 to 200 videos approximately. Apart from those videos which I posted on YouTube, we have another 175 to 200 videos. We have been doing more and more videos. We'll be uploading them in a phased manner, right? Based on the demand and based on your request. Okay? Yeah, Neil Nandan, I have answered your query. Abbas, yes, definitely. Sneha, hi Sneha. Hello sir, a little on time planning. Sneha, see, it has to be custom made, but I can give you definitely a few valuable tips, right? If you're married, then you should have the support of your spouse. If you're married, if you're unmarried, then you should have support of your family members, right? Support in the sense, you should have that atmosphere at home or at work or anywhere where you're going through. Right atmosphere instills a confidence in us. So that's a real essential. You need to see, regarding time planning, to answer a question straight, just try to ponder over this question, Sneha. How many hours are you able to dedicate for preparation every day? A rough estimate. For example, if you're planning initially, you can't expect you can't expect ourselves to dedicate 20 hours or 18 hours. You can't go by fancy numbers, right? So how many hours are you able to dedicate initially? Practically, it's not theoretically I'm asking you. So yes, you might have started your preparation, right? How many hours are you spending? 2 hours, 1 hour, 3 hours? Based on that, you plan your schedule. For example, if you are, as you say, 2 hours as of now, that's fine. That's necessary but not sufficient, as you know. You need to increase it day by day. So once you're starting 2 hours, so when are you spending 2 hours? Is it in the morning session, afternoon, or evening? If you're spending that in the morning session, for example, if you have a habit of, I'm just giving you a kind of idea so that you can build upon it, right? So you can, for example, if you have a habit of waking up early in the morning, you are spending 2 hours for preparation, that's it, then you should make sure that you increase your span of preparation in that particular phase. For example, if you're studying in afternoon, try to increase the span of preparation there rather than allotting a new time in a new session, in the sense afternoon or evening. If you are studying in morning session, extend your preparation time, not in the sense you need to continuously study for hours together. We can't concentrate. Studies have shown that we can't focus or concentrate for more than 25 to 30 minutes. That's the reason why even in theory classes, when we listen, we'll be focused for the first 15-20 minutes, after which we get distracted, right? So we should be practical while we are planning our schedule. So divide your preparation phase wise. For example, if you are spending 2 hours, divide it into 20-minute sessions or 30-minute sessions. Take a short 2-minute or 5-minute break and then again continue preparation. So if you have a habit of studying in the morning 6 to 8, make it 6 to 9 or make it 5 to 9. So in my opinion, I would say morning time is the best time. Morning time, especially 4 o'clock, 4:30 or 5 o'clock is the best time. You'll be free, you'll be clear in mind, you'll not have any ambiguity, any confusion, you'll have more willpower comparatively, because studies, I'm not just I'm not just telling it just like that. I've gone through many studies, and studies have clearly demonstrated. We have one book by a PhD doctor, Willpower. I'm not getting the name of the author. He has clearly mentioned, based on his experiments, that our willpower gradually decreases as the day ends. So that we can say based on our personal experience also. Morning will be very, very much stronger, very much determined, but by the night time, we have that diminishing willpower, and that's the reason why we confess usually during night times. Have you noticed it any time? So willpower diminishes during night time. Concentration, everything, there will be a compromise in our system, right? So morning we have been collecting a lot of information, and gradually the concentration, everything will be winding off. So in my opinion, the best time is morning, 4 o'clock to 9 o'clock. Divide it into sessions, have breakfast, everything else, you need to relax, you need to have the breakfast and all related intervals, and then plan to extend your preparation that morning session, Sneha, and from there gradually extend it to the afternoon session also, just 1 hour or just half an hour or just 20 minutes. Just get used to it, and then gradually start studying in evening session also, right? Slowly try to enter into a new session gradually, and in the process, you know what happens, and in each session, once you enter, expand the time. You know what, gradually what happens in the process of preparation, the beauty of our human mind is when we are preparing, we will realize many things that we still need to know a lot more stuff. If you are going through, for example, a particular chapter, you will realize that there is still a lot to learn. Then obviously you will have that realization that you need to spend more time. That self-realization is very, very important. Once you have that self-realization that you need to spend more time on preparation, then obviously no one needs to really motivate you. You will spend time, you will self-motivate yourself, and you will make sure that you will spend more and more time as you go by in your preparation. So Sneha, right now you said 2 hours, right? So you can gradually increase it to 3 hours, 4 hours. And I'm not saying that you should study 24 hours a day. It's utter nonsense. And if anyone says that you should study for 20 hours a day, 18 hours a day, don't go by that fancy number. It depends on your capacity. How many hours can you dedicate to study? It depends on our individual capacity. Maximum amount, make sure that you spend maximum time. It can be 8 hours, it can be 10 hours. Personally, I started with 1 hour initially, and I personally took my preparation to a maximum of 12 to 13 hours. That's it. The rest 11 to 12 hours I didn't know, frankly, but I used to only that's my limitation, right? So I could only focus on 11 to 12 hours in a given day, right? So that's my personal way of allotting time. So you, based on your understanding, based on your knowledge, based on your confidence, your willpower, your attitude, and most importantly, as I mentioned, your support from your family, right? So these factors, considering these factors, plan your timetable accordingly, plan your day accordingly, right? I hope I answered your question, Sneha. Right, you're welcome. Mariam. Hi, Mariam. Sir, are Mudit Khanna and Amit Ashish necessary for NEET preparation? Mariam, let me just tell you, I've been telling this repeatedly. One book is necessary but not sufficient. You need to refer as many books as possible in a phased manner. Complete of one book first, go ahead with the next book. Or for example, if you're preparing for a weekly test, for example, in our course, we have one weekly test, right? Weekly test in anatomy, for example. You go through various MCQ books covering anatomy, like Mudit Khanna, Neeraj Vadhavan, Pulse, Dentist. So that's one way of approach. Or if you're planning for self-preparation, if you have your own schedule, if you're planning to prepare at a bulk, in bulk, for example, like all subjects at a time, all basics at a time, all clinicals at a time, then what you do is subject wise, you go with multiple choice question books. You start with one book, complete off that book, go with next books. See, it's all like there is no rigid way of preparation. We are a so intelligent, smart species that we can pick on others' ideas. I'll be giving few ideas, I'll be giving few tips. You can build on them, you can have your own ideas, you can share with them, you can construct and you can improvise on my ideas as well, right? So one book is not sufficient. You need to go through other books as well, get exposure to as many MCQs as possible, right? Please suggest one of the book among them. Mariam, I hope I answered your query. Also suggest how to revise. I also mentioned, Mariam, you can just refer the first part of this video later. I'll just summarize that in 30 seconds. How to revise if you're planning to study for one book, for one subject in that particular week. For example, I'm just giving you an example. Go through a synopsis for a brief understanding. Practice MCQs. For example, in anatomy, you have first chapter, right? For example, osteology. So don't go through a synopsis of all subjects, all topics. Synopsis of one topic, multiple choice questions of that topic, explanatory answers, references, notes preparation, and then revision if at all you time, and then you jump on to the next chapter. That's how you can revise, right? So you can even watch the first part of this video for a more detailed explanation, Mari. Sneha, thank you so much, sir. Yeah, you're welcome, Sneha. Next we have Dr. Amit Singh. Amit Singh, sir, you're doing great job. We are all thankful to you. I'm so glad to hear that, Amit. Thank you so much for your love. It's not like I don't know whether I'm doing great job or not, but because you see, it's all the feedback which you give me. I'm trying my best. So whatever best I can do within my limitations, I'm trying my best to give you concepts and information in numerous ways possible. And in fact, I should thank you for your overwhelming response. See, if I don't have this kind of response, then obviously what drives me? What drives me is your support. What drives me is your love. It's an unconditional love which a teacher and a student have, and that's really a motivating factor for me. And I should thank you rather for your wonderful support and motivation, all of you. And Amit, thank you for your love and thank you for your kind words. Yes, we have another comment from Kumari. Kumari, in dental materials, numerical values in options are hard to remember. Yeah, that's true, Kumari. Point 2, point 3, all answers resemble same. How to remember that? See, that's what I've been telling you constantly. Notes. To answer that question straight, it's notes. Once you have these notes, see, no matter how much you memorize, no matter how much you by heart things, as humans, we always have this tendency to forget. We'll definitely forget, right? You'll remember that for 1 week or 1 month. Obviously, see, even I'll tell you one practical example, Kumari. Even when I was explaining one of the topics to my second year students recently, third year students, I was discussing about critical pH, and I forgot the critical pH value. There were times where I was so confident when I was preparing, it used to just pop up in my mind, 5.5, right? So I couldn't really recollect critical pH. See, it's like I prepare for my theory class and go, but out of context, I got that point, and while I was discussing, I couldn't recollect the actual pH. It's not that we don't have proper memory. See, we all have this limitation as humans. We keep on we are subjected to loss of memory gradual over period of time, right? So take it as normal. It's not that you have some Alzheimer's or something, right? It's nothing like that. It's all a normal process. We can stay cool. It's all about revision. A person who revises more, it's not just about collecting information, it's not just about writing information on a piece of notes. It's about revising it repeatedly in an organized manner, in a dedicated manner that helps you reach your target, right? So note down all those key points. Note down all those values in notes separately, Kumari. Keep on memorizing them. And I'm sure you'll remember that at least till your entrance. If you have entrance in 6 months, you'll remember that till your entrance time. After 2 years, if you ask me, will you remember? No, I can't say. It all depends on your memory also, right? So one way is by maintaining notes, Kumari, and another way is by mnemonics. You can formulate mnemonics. So we have different mnemonics, right? So by mnemonics also, so mnemonics, it's difficult to remember numericals. We can remember the words per se using mnemonics, but if you can try, you can even formulate mnemonics for different ways of, for example, I keep on telling this to my students also. We have this confusion, right? Measles, German measles, caused by rubella or rubeola. We have this confusion, right? So how to remember and how to have that clarity rather than getting confused. Actually, in Telugu, we have one song in one movie called Orange. And the name of the song, the song goes by Ruba Ruba, right? So how I remembered that particular theory is German measles, it's caused by rubella, if I'm not wrong. German measles, rubella, right? How do you remember that? So when you watch that song, we have those lyrics, Ruba Ruba. And that song shoot was done somewhere in Europe. So I assumed that that song shoot was done in Germany. And so I started remembering it in that fashion. German measles, rubella, right? Something like that. So you'll have your own memories. You'll have your own experiences. And based on your own experiences, you can customize your own mnemonics, right? And so that's how you can proceed, right? So that's how you can actually frame mnemonics and maintain notes, and that's how you can really gain confidence, right? So I have given you an elaborate explanation. Hope I haven't really gone out of context. Yeah. Next we have question from Shivam. Are questions asked from DCI BDS syllabus? Shivam, yes, of course. The only standard guide or standard reference, or you can't just Shivam, if I say that I'll be giving you some syllabus and if I mail you some syllabus, don't go by it. You need to have a standard reference. A standard reference here is either our university, respective university, or our DCI. If you go by university, you'll have, in NTR University here in Andhra and Telangana, they'll be providing you booklets containing course curriculum. You can either follow the course curriculum given in your respective university, or you can follow the course curriculum given in DCI. So DCI, head of all our institutions, right? It's an autonomous body as far as I know. So you have in DCI website acts and regulations, and there you can find BDS 2007 regulations syllabus, right? So obviously, no matter what the questions are posed, they have to be posed from that syllabus only. If the posed syllabus, if the questions are out of context, out of that syllabus, then we have every right to approach the university or even approach court if necessary to claim that the particular topic is out of syllabus, right? So you can just go by the syllabus given or prescribed by DCI. Consider that a standard reference, right? Hope I answered the query, Shivam. Sidikva, Ayesha, hi Ayesha. Sir, how much depth do we need for preparing medical subjects? Ayesha, it's not that basic subject. Do you mean medical subjects by, you mean to say basic subjects? I think so, right? So no matter whether it's basic or clinical, to speak the truth, we need to have depth. Depth in the sense, not just superficially going through, we need to understand in depth. Only then we can answer analytical questions, application based questions, not just collecting information. It's not just collecting information. Any person who by hearts things will answer. It's right. It's like applying things, right? So you need to go in depth, even in basics also. And also, Ayesha, we have equal weightage in all subjects, as I mentioned. So you need to go extensively in all subjects. It's harsh. It's, truths are always, truth, for example, it's comparatively harsh, right? But we don't have an alternative. We need to put up that effort. It's a very simple logic. You're doing post graduation. Once you complete, you're going to treat a wide range of patients having different medical and dental complications. And how are you going to answer them? You can't say, I'll just find out from my doctor, from a general physician all the time. You need to send them to general physician or gynec or whatever for reference. That's important. But first place, you need to know in order to handle any emergency. So we need to understand that perspective first. So definitely we need to have in-depth analysis of all the subjects which we are going through. Right? Hope I answered your query, Ayesha. Shahnaz, thank you, sir. You're welcome, Shahnaz. Deepak Singh. Hi, Deepak. I'm student of BDS final year from IMS BHU Varanasi. Okay. Please give some suggestion regarding preparation at that time. See, Deepak, don't see if you're talking about entrance orientation or whatever. Since you're in final year, the best thing. When do you have exams, Deepak? This June, July, or maybe next year or January. No matter what it is, you're in final year. Your focus should be only on final year subjects. Only on final year subjects, not other things. Don't go for basic subjects or anything else. Try to focus on all final year subjects. Have standard references. Don't go by guides or previous question and answer guides. Go by your standard textbooks. You'll have clinical exposure. As you will be having your postings, right? For example, you're posted in prosthodontics. So make sure that you go through prosthodontics syllabus in that posting itself. You'll have a posting duration of 30 minutes, which is 30 days, right? So 30 days, which is good enough time for you to go through your various topics in prosthodontics, right? So you can cover subject wise based on that posting, and also it helps you in answering questions if at all the staff come and ask you any questions. And also it also helps you in doing cases when you're doing clinical cases, right? So the things which you learn from your theory, from your standard textbooks, you can definitely apply clinically also, right? So that's the beauty of dentistry. You'll have not only a theoretical exposure but also a practical experience. So it's a biggest positive I see, rather than comparing with engineering. Or, and I'm not saying that we are inferior or superior, but we have this practical exposure which gives us even much more understanding. As Chinese proverb goes, we just see things, we'll just remember it that way. Just do things, you'll just have that registered in your brain, right? So in your final year, Deepak, focus on your clinical subjects, refer standard textbooks, focus on your clinicals. That would be sufficient. That will definitely help you later in your PG preparation also, right? Jagadish, we have another question from you. Sir, for few questions, we don't have exact explanations. So we try to remember that blindly. That's true. And soon we forget that. What do you suggest us for such questions? It's an excellent question, Jagadish. We all commonly neglect this aspect. We will only have limited information because, see, practically also it's not feasible to give elaborate information pertaining to each question, right? So what you do is, Jagadish, once you solve that multiple choice question, once you go through that explanation, which is very brief, based on that, you try to refer a standard textbook for understanding. And if you find much more information, much more key information related to that multiple choice question, for example, they ask you Vickers hardness number, VHN of amalgam, it's around 9200, right? So the explanation is Vickers hardness number, it's a micro hardness test, and the Vickers hardness value for amalgam is this much, composite is this much. They'll be giving a very brief explanation, and that's it. So what you do is, go back through a dental materials textbook, Phillips, open it, go through hardness tests. We have different hardness tests, macro, micro, nano hardness tests, different classifications, right? And different sizes of indenters, right? Make a notes of it. You have two options, Jagadish, here. You can make a notes of it briefly, important points, or you can make a stick notes. Just you have these stick notes, right? A small piece of paper which you can stick on walls or on textbooks. Make a stick note, note down important points, prepare notes on that and stick it on the same page of your standard textbook, so that it will help you for your future reference also, and also helps you gaining confidence, right? That's how you can go. See, it's practically impossible to go to do this for all multiple choice questions, right? It's not possible for all multiple choice questions, but you will know for which questions you need to approach, right? So based on that you can proceed, and you need to have a lot of patience for this. You need to have a lot of patience, passion for this, passion to learn, passion to acquire as much information as possible. And even now, see, let me just show me my book. I have my book here, luckily. So this is my Phillips textbook, which I bought way back in 2006. And if you observe, I have even some stick notes here. Yeah, I'm not trying to exaggerate. Since I'm saying, I say what I do, what I practice. See, I think you can see it now. I think it's glossy. Yeah, right. Can you see a stick notes here? So that's how I used to maintain stick notes all over my textbook. You also have stick notes in different topics also, right? We have another stick notes here. So we have another stick notes. This is related to hardness. We have another stick notes here, right? So that's how you can maintain stick notes all over your standard textbooks, right? That helps you in for future referral also, right? So that's one way of preparing. Or you can just maintain a short notes or notes, elaborate notes pertaining to that topic, right? So that's how you need to build on your preparation rather than relying on that one particular explanatory answer. Jagadish, I should thank you for asking this question. This is a very important aspect which we need to discuss, right? Yeah, I hope I answered your question, Jagadish. Shivam, thank you, sir. Great job by you. Yeah, you're welcome, Shivam, and thank you for your love. Kumari, I have prepared for pharma in Jan last week. When I revise it now, I feel like preparing again newly and time consuming. It's normal. Is it normal, sir? Kumari, it's absolutely normal. As I mentioned previously, definitely we'll tend to forget it. It's like everything new again, especially the drugs, the classifications. It will be totally new again. But you know what? We think that it's new, but it will be registered in our subconscious mind, and that you will realize in your exam day or when you're practicing multiple choice questions, because once you have that right confidence, you'll definitely have that running in your subconscious mind. It will be registered in your brain. You'll not believe it, but that's the capacity we have. We undermine ourselves most often, but that's the capacity we all have. Definitely you'll feel that new, nothing to worry. Just ignore that. Just go through your preparation again, and on the exam day you should be confident enough. Though if you're confident enough, you'll definitely get everything in your mind. But if you're panicky, if you're tensed up, then obviously your brain shuts down. You can't really recollect all the important information. So you need to maintain your cool, and that cool and confidence you will get with practice, right? So Kumar, it's absolutely normal, nothing to worry about, right? Deepak, thank you so much, sir. You're welcome, Deepak. My pleasure. Right. So we have had many questions and comments here, and previously I thought like I could store all these comments, but unfortunately I'm losing these comments once the video is getting processed and uploaded. So, anyways, that's the reason why I've been reading those comments, so that it helps me. It serves as a reference for me in future also, right? So it's already 67 minutes. We have taken a lot of time. Okay, more than 1 hour. So guys, do you think we should continue? So it's 8:40 Indian Standard Time. So I have any other questions? I'll try to stay for another few minutes, right? Another few minutes, and in the process, we'll see what more we can discuss, right? And also, I'll just, before concluding, I would like to speak briefly about food and sleep also. See, we often tend to neglect this. Food, as I keep on saying, make sure that you have quality food. The moment you have oily food, the moment you have high carbs, you'll feel more lazy, definitely. Because as you all know, we're all science students, right? The moment we consume a lot of food, you know what happens? Most of the circulation will be shifted to our digestion process, and we feel a bit lazy, we feel sleepy, drowsy, right? So it's not that you should stop eating. You should have healthy food, limited quantities, divide it into number of doses every day, eat 6 times a day, 7 times a day, right? If it is practically feasible. right? And make sure that you avoid oily food, high carbs, masalas, and all that stuff, right? Try to avoid them. Have healthy diet, have fruits, and my personal favorite is green tea. Go by green tea, you'll have a lot many antioxidants, you'll feel fresh, your throat is good, you feel definitely fresh, right? So that's pertaining to food. We can have a wide range of discussion on this. I'll just limit my discussion here itself, pertaining to food and sleep. I have recently seen one video published by Center for Disease Control and National Sleep Foundation, where they have clearly demonstrated that we are having an epidemic of sleep deprivation. Most of us have a sleep deprivation, but we don't really realize that unless it is too late. But once it is too late, once the damage has been done physiologically, psychologically, then it will be a bit challenging to overcome that, right? To keep it simple, National Sleep Foundation, Center for Disease Control suggests a minimum sleep of, see, they have given various sleeping hours for different age groups. Let me not discuss everything and bore you. Let me just put it straightforward. As most of us are in an age group of 19 to 26 or less than 30, right? We need to have a minimum sleep of 7 to 9 hours. See, there is no standard time like only 7 hours or only 8 hours, right? So they have given us a range, and it's based on various studies, various cross-section studies, longitudinal studies. Once we have this adequate sleep, and I'm telling you this, don't take this for granted. This is very important. Sleep is a best investment. It's not a waste of time. Once you have a quality sleep, a sound sleep, a satisfying sleep, you'll feel more active, more enthusiastic, and you'll definitely improve the scale of your preparation enormously, right? Take my word for granted. So have this quality sleep, stress-free sleep, and minimum of 7 to 9 hours sleep, right? So that really helps you stay focused, right? We'll discuss many such things in the coming future, in coming sessions as well. And yeah, Deepak, you have another question. Can I join any test series along with final year? Please, sir. Deepak, even we are offering a test series and online lecture series. See, if you feel like you can, for example, as I mentioned previously, you are in one posting, for example, endodontic posting. You're going through endodontic textbooks, right? So, pertaining to that subject, you can definitely do multiple choice questions, right? If you can spend half an hour a day or 20 minutes a day, you can definitely solve multiple choice questions, right? So that it all depends on your interest. See, there is nothing like you shouldn't do multiple choice questions or you shouldn't do it. When I used to practice MCQs in my second year BDS, people, seniors used to mock me. Who cares? Why should you care for others? If you are really interested, if you want to really learn, really want to practice, focus on what's important at that particular time period, as I mentioned previously, and along with that, you can practice whatever you want, provided you have a right balance, right? So of course you can take up test series, of course you can practice multiple choice questions, and you can elevate your preparation, right? So any other question, guys? Right, so it's already 72 minutes. Yeah, we have one more question. Kumari, right? I'm able to concentrate only 4 hours a day. Can prepare only 2 topics a day, but I'll prepare completely. Though I have more preparation, I couldn't spend more time. Okay, married to it's enough, right? See, Kumari, that's fine. Even during my initial days, I could spend only 3 to 5 hours a day for a period of 3 to 4 months, right? So for the first 3-4 months of my preparation, out of 6 months, I spent only 3 to 4 or 5 hours maximum. That's sufficient, Kumari. But provided it's not about quantity. Let me just focus on this briefly. It's not just about quantity, it's about the quality of your preparation. 4 hours with focus and concentration with periodic breaks. That's more important rather than the duration of time. You focus, you have utmost concentration, you give your 100%, on that particular time duration. Yes, 4 hours would be suffice initially, and as I keep on saying, it is sufficient but not, it is necessary but not sufficient, right? You need to increase your preparation duration day by day, because syllabus is so huge, so vast. You need to really go through various topics, you need to cover various subjects. So definitely I personally feel that 4 hours is necessary but not sufficient. You need to enhance your preparation. Duration of your preparation in a gradual process, right? Don't be in a hurry, or don't feel tensed up since I'm saying that it's not sufficient. You'll understand that as we go on, right? So definitely make sure that at a particular time period in your preparation, in a course of preparation, try to spend maximum amount of time you can personally on your preparation. If it's 4 hours, that's sufficient, right? So it all depends on your level of motivation also. So since you're married, you'll have your own constraints, you'll have your own responsibilities. Yes, definitely you need to have your family support also, and you can definitely overcome that. And yes, of course we can do. It's not about 4 hours, 5 hours, or 10 hours. Of course we can do, provided we are dedicating ourselves to the task at hand, right? So that's it, guys. So it's already 75 minutes, so more than 1 hour 15 minutes. So it's been a lengthy session. So we'll do more and more general Q&A sessions in the course of time, and also I'll be planning simultaneously topic based live sessions also. So in the coming future, I'll be discussing few topics simultaneously, and we'll have a discussion over that topic, right? Topic and related multiple choice questions, and based on your comments, if at all any elaborate explanation is needed, I'll definitely give elaborate explanation also, right? So we'll discuss topic wise in the coming sessions, and also we'll do more and more live question and answer sessions also, right? So Ayesha, okay, I'll take up this one more comment. Only 6 months remaining for exam. How to cover all subjects? What should be the schedule, sir? Ayesha, you just mail us at proudtobedentist@gmail.com. We'll send you the schedule. We have designed a new schedule. We have devised a new schedule for starting from May. You can follow that, or you can just customize it based on your time availability from this coming Sunday or from this coming month of June, right? So you can mail us. We'll send you the schedule, and of course you can cover all subjects. And that depends upon your prior understanding of subjects and your prior knowledge and information and confidence, right? So be confident, be positive, and I would like to conclude this session by one quote given by Einstein, right? So I love quotes. So whenever I get an opportunity, I take this opportunity, or any opportunity, to just mention few quotes, so that gives me immense satisfaction and confidence as well. See, we have one quote by Einstein, who says that if you judge a fish by its ability to climb a tree, it will live its whole life believing that it's a stupid, right? Hope you understood what I said. It's not like there is something fixed things in life. It's not like we need to follow that blindly. It's not like only once you follow that prefixed scaffold, or only once you go and fit into that, you'll succeed. Nothing like that. You have your own potential. I have my own potential. Every one of us have our own potential. We all can achieve whatever we wish to, provided we should dream big and we should work towards our dreams. Not just dreaming, but working incessantly, working with passion, with utmost dedication, giving ourselves to the task at hand. We can achieve everything. It's not that only once you score rank, only once you score high, you are great. No, it's utter nonsense. You can achieve anything in your own way. So rather than trying to mimic something, we can be a leader. We can lead new things. We can really motivate ourselves in doing new things, and be a source of inspiration to lot many others, right? So just keep a thought on this quote and work accordingly. It's not like you need to follow a rigid schedule, a rigid things, and don't go by what someone says. Even what I say, don't go blindly by what others say. Believe in yourself. Have confidence. If your seniors say you can't crack entrance in first exam, don't buy that thought. It's utterly nonsense. Don't go by such things. You believe in yourself, you give 100% to the task at hand, and there is nothing impossible to achieve, right? So hope I gave you some valuable inputs. And we have Satyadev. Hi Satyadev. Yeah, thanks a lot for such informative session. Right. Yeah. Thank you, Satyadev, and thanks for your love. That's what I can say. What can I say? What more can I say? For all your love, I can just reciprocate that love in form of my work. So this is my added motivation, this gives me motivation. I'll do whatever I can, give the best of my ability to work for you. And see, this is not for money. Money is secondary. Money comes, it's secondary. But once you have that passion, once you have that dream, once you achieve that dream, that kind of satisfaction, that kind of immense satisfaction which we get cannot be matched with money, cannot be matched in monetary terms, right? So it's not about money, it's about passion, right? So let's all work together, passion with passion and dedication, and try to create let's try to create new things rather than blindly following something already there, right? So let's try to be a source of inspiration to lot many people who are looking towards us, right? Yeah. Okay, so I'll conclude this session, and it's such an overwhelming response again. Thank you so much for your love. Thank you, thank you, thanks a lot for joining me. And next session I'll be announcing it on YouTube, Facebook, Twitter, whatever the platform is, and we'll see whether we'll go with a general question and answer session or a topic wise session, right? So I'll decide, and accordingly I'll just post that, and based on that we'll just move forward every week, right? So see you all soon, and I love you all, right? Yeah, bye, good night, have a nice day, and have a great sleep. Sleep tight, sleep right, and dream bright, right? Bye.